Tears and deflection. A chastened Premier Doug Ford speaks publicly for the first time since his government's disastrous announcement last Friday and admits they went too far.
I'm sorry, and I apologize to each and every one of you. Simply put, we got it wrong.
It's not often a politician says, "I'm sorry," and maybe rarer still to see them choke back tears.
People telling me their stories, the stories that could make you cry, families that haven't been able to hold hand. Hold on, folks. I apologize.
But don't be fooled. This is a premier who has no intention of heeding the barrage of calls to resign.
I'm not one to walk away from anything. You know, we're going to continue to lead throughout this pandemic.
The public erupted in visceral anger on Friday, fed up with a government that showed it was not listening to science when it imposed random police stops and closed playgrounds, which experts were not calling for, while it didn't initiate paid sick days, which experts were calling for. Nor did the government listen back in February when the Science Advisory Table warned a deadly third wave would explode if restrictions were eased. The government went ahead and eased them. Ford defended that today, too, and said he was not to blame for the third wave.
To say that I'm the reason there's a third wave around the world, because it is around the world, to say that I'm responsible for not securing our borders that brought this variant and caused the third wave.
While new COVID cases dropped below 4,000 today, ICU cases hit a new high again, rising to over 800, pushing hospitals to the brink. All non-urgent surgeries across the province have been cancelled, but even urgent ones are in jeopardy. Last night, a Sunnybrook doctor tweeted a patient in his 20s had a brain hemorrhage, but he couldn't operate because the hospital was full of COVID cases. Writing the man's life was slipping away. Dr. Lipsman tells City News the patient did ultimately get surgery, but staff had to move mountains to make it happen.
He's done well so far.
How bad is the situation in hospitals right now?
It's unprecedented, and it is bad. I would say that we're not heading to, but we are actively in a healthcare crisis.
Several doctors say the majority of COVID patients are essential workers or their families. After a year of pressure, the Ford government is now working on a plan for paid sick days. But the premier offered no details or timeline. Ironically, he's in isolation at his late mother's home, able to work with no danger of losing pay. The opposition is not buying the premier's mea culpa, saying it's too little, too late.
What we needed from our premier and from the government was action to save lives, and we didn't get that.
And amidst all the sadness of the past year, a horrifying update at today's medical briefing. Ontario's chief coroner said people are dying at home, something they haven't really seen until now. There have been about 2 deaths a day for the past 2 weeks. Some were even in their 30s. All didn't need to be in hospital based on symptoms, but deteriorated so quickly they were found by their loved ones.